sure you hit the nerve.
Okay.
So transducer.
Uh-huh.
And right now we're underneath the linear 25.
Okay.
We want to make sure that we hit the nerve setting.
Okay, linear 25, the one, 1361, okay.
And then if you go back underneath transducer,
Mm-hmm.
and if you want to switch to the C60, maybe you're doing a popliteal or hip or something like that, or adductor, then you can switch over.
Okay.
And then from there, you're going to make sure that you select the correct exam type underneath that transducer too.
Okay.
So transducer,
Mm-hmm.
and then you'll see where it says nerve. You select that one.
Okay.
Okay, that's the most important for you.
Okay.
Because it's going to make your borders pop and make sure that you can actually see around it a little bit better. Okay.
Okay.
When your gain and your depth, things that you're used to changing the most are going to be right here with these two buttons.
Okay.
Same as if you used any other machine.
Okay.
Have you used sonocytes before?
I mean, usually we have ultrasound technician comes in and
Okay.
she helps us. But
She helps you with the machine
yeah,
to work it? Okay.
but not with this though, but they bring their own machine.
They bring their own machine.
Yeah.
Okay, I got you now.
Yeah.
Okay. So
The one the size of a Volkswagen.
yeah, the big ones I used to
usual depth, how far do you go? Usually depth to 2?
Every both transducers are different in depth. This goes down to 6 cms only, and this one's going to go down to 30.
Oh, 36 cm?
Yes,
Oh,
but
okay.
this is going to be a different field of view for you. So
Okay.
that curved is going to be a wide field,
Okay.
right? This one's going to be very superficial imaging. So if you're doing like your interscalings,
Uh-huh,
things like
yeah,
that, then
yeah.
you're going to use this linear.
For the femoral?
Femoral, you can you could use this transducer
Okay.
for femoral. It's going to give you a smaller.
Yeah. So rather use the other one, right? Linear, yeah.
I would stick with this one first.
Really?
Yep.
Even femoral too?
Depending on your depth.
Yeah, depth,
I mean,
okay.
the nice thing would have been if you guys had one more transducer,
Uh-huh.
like the 38, because it would at least give you more real estate to look at. And it goes down to 9 centimeters.
Okay.
So that's the ideal
Okay.
one for femoral.
Okay.
Okay.
Mhm.
But it could be, you might have a tougher time sometimes seeing with this one, only
Okay.
because it does only go down to 6.
Okay.
So you'll have to see what looks best for you.
Okay. Okay.
Okay. When you if you have to save your pictures,
Uh-huh.
are you going to print out?
It may not be, yeah.
Okay. So either if you save it to the hard drive,
Uh-huh. Yeah.
it's simply going to be there.
Okay.
We'll save it to the hard drive for
Okay.
you. If you're saving to the hard drive, then you do want to put in patient information.
Okay.
Another thing is that this is not your archiver, okay? So we don't want any HIPAA violations because this is a touch screen. I did have this happen at one facility, which was they had it sitting in the hall and someone went past and just kind of, someone walking by,
really?
hit this list and it brought up a list and it was just sitting in the hallway with all this patient information on there. If you don't need to save a picture, if you're not billing for it yet, if you're not doing anything, don't save it here.
Okay.
Okay. Or if you're going to save it, don't put in any patient information until you guys know precisely where it's going,
Okay.
or delete it off. So if I wanted to delete that patient real quick, I would just come over here and select them. And then down here, you notice once I select it, it will ask if I want to archive it, delete it. You can export to USB if need be. Okay. Am I missing anything that you use it for
No.
besides those two buttons?
But yeah, they're
Do you use
pretty easy
color?
to. Yeah, color
Okay.
too. Yeah.
So if you,
With
let me get out of here. Color, real simple. We put color on.
Okay.
You can make this bigger or smaller
Oh, I see. Okay.
and move this around.
Okay.
Okay. So once I hit this select button here,
Uh-huh.
it toggles between the size of the color box and then the position.
Oh, I see. Okay.
Okay. Or you can do it up here on the screen. I usually try to keep my hands off of that, especially if I'm working the system for you.
Okay.
I try to keep everything on the trackpad here. And then 2D will get you guys back out of everything.
Do they use much for the subclavian sticks?
Yeah, subclavian, it's a little bit harder because you're trying to get that beam underneath.
Yes,
And it can be a little bit tough.
but external jugular, you can use it.
Oh,
right?
yeah.
Okay.
Absolutely. So you can do, like, if you have to do a central line, if you need to look for a
Which one?
pneumothorax.
Central and usually 13 cm. Okay.
Yep. And then if you're trying to look for like a pneumothorax, like a
Yeah.
lung, you can do that with this one too.
Okay.
That will work.
Yeah, fairly simple, right? All you have
It's
to do.
really easy system. It's pretty straightforward. You guys really can't get really too wrapped up Everything's
Okay.
on the screen that you need.
Okay.
It's just touch, so.
Okay.
And then I believe there should be a quick start guide. I know I sent one to you in that first email. I usually attach them. And then there should have been one sent if your clinical left it in here somewhere. There it is. So some people will laminate this too and leave it on the machine.
Yeah, do you have one? Maybe.
That's your guys'.
This one. Okay.
I'll get it laminated
Yeah,
and
yeah.
stick it to the machine
Okay,
so
yeah.
it's on there.
Yeah.
Yeah.
And it's real easy. It's real simple.
Yeah.
Anything else you can think of that you're gonna
No.
use it for?